This question says some heart patients have replacement valves, mechanical or biological, from a pig. Suggest reasons why a patient may choose a mechanical valve and not a biological valve from a pig. And it's worth 6 marks. So it's a suggest question, so we've got to give a suitable reason why. We don't have to give any explanation. We've got to compare a mechanical valve against a non-mechanical valve, so a biological valve from a pig. We've got a table here that talks about a mechanical valve and compares it to a biological valve from a pig. So we've got to talk about the advantages. So let's talk about advantages of mechanical valves first of all. So they're made of plastic or metal, therefore they're long lasting. Don't need to go into hospital or surgery again, as it says that there's no need for a replacement valve after 5 years. There's no ethical issues because we're not using any living or animal tissue. There's no risk of rejection, therefore, because we're not using living tissue, and therefore the patient doesn't need to take anti-rejection or immunosuppressant drugs for the rest of their life. There's also, because we're not using living tissue, no risk of transmission of diseases like viruses or bacteria. The advantages of biological heart valves is there's no need to take anti-clogging medication, because the biological valves there's no risk of clotting around the valve, whereas mechanical valves there is a risk of clotting. You can't hear a pig valve. The mechanical valve is made of plastic or metal, moving parts, which is very noisy. Pig valve you won't hear. We know there's clotting around the valve for mechanical valve. There's less chance of blood clots around the valve because you can get a better fit with a pig valve, and therefore there's less likely to get a heart attack or a stroke caused by those blood clots. So 6 marks. We've talked about advantages of mechanical valves and advantages of biological valves.